Hi everyone, thank you again. Welcome to today's webinar for DataCon LA. Today we have Gene Home, Chief Data Officer from City of LA, talking about data challenges in Los Angeles during the time of COVID-19. Prior to get starting, just a few quick announcements. DataCon LA registration is open, so if you're interested in joining and learning some of the latest and greatest in data, please feel to go to the DataCon LA website and register. This year it's going to be spread among 3 days, October 23rd to the 25th. We're going to have some really good and great talks, great panels as well as tutorials. So please feel free to join up over there. Also on a side note, if you haven't been notified, we are also looking for volunteers for Data for Good. So it is this organization that was spun off from DataCon LA just under a year ago. It's a non-profit that's currently in the process of getting accredited, and Jean and myself are part of the board. We are currently looking for volunteers to help in some cool projects such as um, data literacy, data portal, um, clean air, and other great projects that we feel will make great social uh, impacts in our current city as well as the county. So if you are interested, again, go to DataCon LA and sign up. We definitely would like to have you join us. With that, I'll pass it on to Jean. Jean, thank you very much again for joining us. Please feel free to kick this off.
Sure, no problem. So I appreciate everybody joining tonight. I know it's the end of a long day and probably the end of a long week for a lot of folks. Again, my name is Jean Holm. I'm the Chief Data Officer and Senior Technology Advisor to the Mayor of Los Angeles, Mayor Eric Garcetti. And as you can imagine, there's been quite a bit going on. Before I came to this role, I worked for NASA for 30 years as the Chief Knowledge Architect. I did 6 years with the Obama administration, helping to build data.gov, and then several years with the World Bank working in Central Africa, building open data ecosystems. So I come with a pretty rich data background, and what I wanted to share today was really what we're doing around open data and how data and tech are helping the city during this time. Subhash, if I could just get access to be able to share the screen.
Yeah, 1 second.
While we sort that out.
Go ahead.
Okay, great, perfect. One second. If you have questions during the discussion, feel free to put them in the chat. I'll be watching that as well. And
yeah, we also have a Q&A. So if you also want to raise a question, you can use the Q&A tool as well. Jean, the chat may get a little bit more congested. So if anyone really wants to ask a question, please use a Q&A tool. That way it makes it easier for Jean to look at the questions that may come in.
For some reason, it's not.
Can you share the screen? Or?
I'm trying. It's not allowing me to. It's the link that I sent you earlier.
Okay, let me. Yeah, yep, sure, no worries.
Okay.
Just give me a second, almost.
I think it's that upgrade to Zoom.
Here you go. Can you see it?
Yeah, thanks very much.
Okay.
Great, if you just hit the present, so it'll be a little easier for folks to see.
This one? I don't know which one is it. Oh, radio. There you go. Okay.
Perfect. Thanks. So, as everybody has been experiencing, we're in the midst of sort of three different things that are challenging the ability to kind of move around the city of Los Angeles and the cities all over. There are issues going on around the pandemic, the aspects of economic recession, really, that's happening because of folks not being able to get to work or businesses not being open. And then thirdly, really this, for many cities, especially in the United States, we have protests and concerns about racial justice going on. All of these things just make it really challenging to try to keep it as safe as possible for folks and to be able to make sure that everybody has the ability to exercise their rights. So the next slide really talks about the priorities of the city. So during this time, we're really focused on the idea of making sure that we are improving public health to the maximum extent possible. In this case, we're really looking at making sure that the health outcomes are optimized as much as possible. And that's why the mayor and I and everybody else really appreciates everybody staying safer at home for so much of this year and keeping the social distance in place. Part of the challenge in sort of administering that is the fact that Southern California, as many other areas, is comprised of many counties. Each of those counties has a different public health officer. Some of the cities have public health officers. All these folks need to work in coordination with each other and trying to come up with the same set of timelines for reopening and for if you wear masks and all that sort of thing. So there's a fair amount of work in the background that is generally invisible to the public to making sure that we can improve the health outcomes. And a big part of this is really working with data. We want to make sure that the residents are staying safe and well, but also we want to make sure our city staff is. So at the beginning of this, we closed down a lot of facilities, both to encourage people to stay at home, but also to decrease the exposure to COVID. Even though things are closed, a lot of city work is still being done. The vast majority of city work is being done. Calls are being answered, animals at the zoo are being fed, trash is being picked up, potholes are being filled, traffic continues to flow. So all the things that you would expect from your city are available with the exception of some of the location-based services. But we need to make sure that everybody stays healthy. We also needed to move people to telework really quickly. And I'll talk a little bit about kind of how we did this to get 24,000 employees working virtually within 10 days. And then we just want to make sure that all of you have the up-to-date information about what's the safest recommendations for moving about the city and making sure that you're all informed, whether you're owning a business or you're just living here in the city or you're visiting the city, about the best way to kind of make sure everyone stays safe. And then right now, we're also challenged with understanding some of the issues around racial equity and some of the embedded racism that has been persistent throughout our culture, and how we start to address issues of economic equity as we try to help people through this time when so many people have suddenly become either unemployed or not getting an income, and we need to help people meet those basic needs. So the next slide. So each night, the mayor holds a nightly press conference, and this started during COVID because we realized that people needed to hear directly from him about what was going on. The mayor happens to be trilingual, and so it's helpful that he can give his remarks in both English and Spanish for our population, but also to be able to give that information online. But not everybody is able to, not everybody has a computer or internet access or is able to kind of have that same digital literacy. So we wanted to provide it in different ways. So at the time I was managing 3 television stations for the city, as well as social media, and then a lot of the data analytics work. And so we stood up these nightly press conferences and we broadcast them on the city's television stations, which are channels 24, 35, and 36 inside the city. And then those are also broadcast over social media and on the internet. We also pushed this information out over social media. The city has well over 100 social media channels for different departments, and we just made sure we had consistent messaging. And then we started building this coronavirus.lacity.org page, which really let people come as we started to evolve policies, as we started to learn more information. We wanted to publish data and maps. And we wanted to let people have access to the programs that we were standing up as individuals really started to express what they needed from different communities. The next slide shows you one of the things the mayor always starts with. Not this slide particularly, but every night he starts with, let me start with the data. And so that data drives a huge amount of the decisions that we make as a city. We look at the number of cases and deaths. We break that down by neighborhood and ethnicity and people who, and by age when we know that information, so that we're able to really target the best support and interventions to the neighborhoods that are suffering the most. We also look at the positive test rate. We were the first city in the country to provide free testing for anybody, whether they were symptomatic or not. This means that anybody, and this continues today, if you are concerned that you might have COVID, you can walk into any of our test facilities, or most of them are drive-through, but we do have a few walk-in ones, and be able to get a test and for free. And the important part of that is that the ability for us to control the spread of the disease is by helping people understand if they are contagious, so they know when to quarantine, most importantly. For a lot of people, the cost of the test or the convenience of the test means that they won't take it if it's neither affordable nor convenient. And so we really wanted, and the mayor really wanted, to make sure that we made that available to everybody. We also look at the hospitalization rate. This is important. If you think back to the early days of the virus and what was happening in New York City, you saw that hospitals got overwhelmed and they weren't able to treat every patient with all of the care that they needed in order to have as many survive as possible. And so we want to make sure that we're constantly watching the ability for the local hospitals to handle that capacity. And that's part of why we try to flatten the curve. We try to make sure that people are keeping apart so that we don't have a spike in cases. And so we work with all of our local private and public hospitals and with our county and with nearby counties to make sure that the capacity, that we're always trying to stay under the capacity. And some of you might have also realized that there was a point at which the health system and the hospitals asked people to postpone elective surgeries so that we again would have that capacity in place at hospitals. We've also noticed things like a decrease in crime because people aren't out and about, and of course, an increase in unemployment. The reason we started to portray some of the information in this rather sort of simplistic way was people wanted to know the numbers, but they also wanted to know, in general, are we getting better or worse in certain things? Because in some cases, we want the numbers to decrease. We want the number of deaths to decrease. In other cases, we want the numbers to increase. We want the number of tests to increase. We want more people to be tested. And so it can be a little confusing, so we try to make it simple for folks. Next slide. And then we also summarize it kind of again in a very clear way to do comparative data between what's happening at the city and county, what's happening in the state, the United States, and globally, to just give some context around the things that are going on. Each night when the mayor gives his press conference, we also provide all this information, and currently it's available both as a map and then also as a PDF document, but we'll be shortly making all that data available as interactive data sets. Next slide. So we work very closely, as I said, with the county, and the city is completely subsumed inside the county, and there are actually 88 cities in Los Angeles County. We're far and away the largest, but these other cities also are working in coordination so that if you're moving from Beverly Hills into the city and then to Santa Monica, that the same kinds of rules apply so that people who don't really know where the boundaries of these cities are in reality are finding that things happen consistently. So in all places in California now, masks are required, but for a while there, it did go down to the county level. So this guide to reopening is another way for us to kind of help, particularly folks understand as we start to disaggregate the data, what's going on across different ethnicities and in different poverty lines. And you can see here, for example, what we've started to understand is that COVID doesn't treat everybody the same. So people who are in poorer neighborhoods tend to have a higher risk factor. You can see that all of the numbers here, this was just a couple of days ago, are going in general down, except in areas where we have very high poverty, and that is going up. And that's complicated. There's lots of reasons why that is happening, but a big reason is exposure, that people in those neighborhoods are often on public transportation. They have jobs that may require them to physically be somewhere, like at a grocery store. And so they have a higher exposure rate. And so these are things that we need to understand as a city, so that, for example, when we deploy testing facilities around the city, we want to make sure that we're putting more in areas where we're having higher incidences in some of these poorer neighborhoods that also are walk-in clinics, not just drive-in clinics, and that we're putting them where people need to be able to get to them in order to keep that infection rate down. Next slide. So as I mentioned, one of the things that we were challenged with as a city, kind of behind the scenes to do, but do right away, was as things started to shut down in March, we realized we would need to also close a lot of facilities, and we didn't want people coming into the office just to sort of be at their computer there and doing administrative or work that they could potentially be doing at home. So almost overnight, we put up this site called connecttolecity.org, which you can get to from outside. And this lets people who are working at the city be able to access their computer systems and do their work from home. So within 10 days, we were able to move about 24,000 of our employees out of a total of almost 50,000 employees to a work from home plan. So they were able to securely access their systems because we're on Google for a lot of our applications. We're able to, some people only needed access to the Google Drive and their information. And then the other thing was that we wanted them to also understand the policies, how to do their time, if they had a city phone, how they could access things just on their phone as needed. And so, so all of that, and they could also access their workstation at the office. So we didn't have to move our legacy systems into anything else. We were able to kind of work it all through remote access. The reason some of this was able to happen so quickly is that the year before, so I managed 311, where you call in for non-emergency issues at the city. So the 311 call center, a year before, we had decided to make that a virtual operation because a lot of the folks who worked in the call center were coming in from a long distance and commuting. A lot of them had, personal challenges with family, and to be honest, that job can be done completely virtually. So we gave them the option of working from home. And so we'd already had a year under our belts of a work from home project that had worked very smoothly, that we'd worked with our labor unions in advance, that we'd been able to kind of work through all the kinks of that kind of a system. And so we were able to quickly take that as a model and move it forward for the rest of the city. On the next slide, one of the things that one of the things we traditionally don't do at the city is that we traditionally don't offer social services. That's something that the county is funded to do and chartered to do and manages. So while we get involved in issues around homelessness and helping to support the county in building more homeless housing, and that we do some support for people in need, that generally those social services come from the county. But in this case, the county had a lot on their plate. So we started looking at where there was the most need. And our 301 call center was actually, and social media were actually a great place for where we heard feedback from the public about what they were most concerned about and what they really needed. So people were concerned about the fact that suddenly so many people were out of work and weren't getting a paycheck. We had students from LA Unified who suddenly couldn't get to class because they would close the schools down and they didn't have internet or a computer at home. We had seniors who understood that they were at a higher risk for contracting COVID and having serious complications, but they still needed to go out to get food. And there were other kinds of services that people were asking for. So on the next slide, these are new services that we've stood up as a city that we were never sort of funded for, chartered for, or managed really. And I'm just going to kind of touch base on a few of these to just let you know the kinds of things we've been doing. So the Angelino card is a new program that's funded entirely by donations from individuals who want to help each other. So the Angelino card is a MasterCard debit card that is provided to people sort of in the most extreme poverty. We did an application process. We had over, just to kind of give you a sense of the need, we had over 450,000 applications for that card. We were able to get a small percentage of them, the cards, because we had over $20 million donated. So we did a round of that. We're about to do a second round of support for those folks, and that was about $1,500 of cash for them to spend. When we asked people what they were spending the money on, it turns out that 90% of what people spent money on was food. So it was really for people who were really very needy and needed that sort of quick cash infusion. We also normally provide meals for seniors in our senior centers, so people can go to the senior center and be able to get a meal during the day, but we had closed the senior center. So we offered to many, many more seniors the ability to sign up for emergency meals. So these are 3 meals a day that are delivered to your home. And what we do is we buy those meals from local restaurants. So we're supporting the businesses that were themselves kind of affected. And we're getting those meals delivered to seniors so they don't have to put themselves at risk, nor are we and we're making sure that they're taken care of and they have a sort of a check-in each day. We're providing over 200,000 meals a week that way. Project Room Key focuses on our homeless population. So almost overnight, when we closed down our recreation centers all around the city, we reopened many of those as emergency homeless shelters, which is what we normally do during the winter when we have particularly cold weather. We'll do an emergency shelter. So we had the basic infrastructure for some of that, but we just really opened it up overnight. And so now that's morphed into something we call Project Room Key. So we're moving the folks out of the emergency centers and we're putting them into hotel rooms, which again does 2 things. One is it houses people who are in the streets, particularly the older homeless individuals. We're working on, we've got about 4,000 people housed right now, and we're trying to get that number up to 6,000 or 7,000. And we also then are buying essentially those nights for hotel rooms from the local hotels, which are employing people. So this lets us help those hotels stay afloat, keeps people employed, and also takes people off the streets and helps them get stabilized. The other services focus on a variety of things mentioned here. Some are focused on helping businesses get through the process of applying for paycheck protection programs and federal aid that will help them stay afloat. Logistics victory is around the personal protective equipment that you might have heard about, that everybody is concerned as we have sort of surges in the need for hospital support. All of these are brand new programs, and LA Represents is helping immigrants kind of work their way through the process too. So all of these are programs that literally did not exist in early March, and that we've stood up in most cases at no cost to taxpayers because they either are augmented by federal aid or by personal donations. The next slide.
Hey, Jean, quick thing. There are a few questions that came
Sure.
up. I don't know if you want to take them now or do them later.
Sure. Thank you for pointing that out. So David asks, with the federal government's stance on testing and actions to pull back funding, will this affect the free testing program in the city? And will it affect LA financially? So we are currently managing, I can't remember the number, 17 different test facilities. And then the CVS and Walgreens to a lesser extent have also open test facilities. All of these can be scheduled from our city site, but not all of them are being paid by our city site. So in some cases, federal funding is paying for some of this. We are committed as a city to continue to make sure that testing is free and available for folks, whether or not they are currently having symptoms, because we know that it's possible that up to 50%, 40 or 50% of the people who have COVID are asymptomatic. The scientists are still kind of looking at that and trying to understand what's going on, but we're seeing a large number of people who are asymptomatic but could be contagious. And so we want to make sure we're committed to that. The impact on LA financially, we're trying to use what's called CARES funding, which is federal funding that's already been given to the city. So this is money that we've already got from the federal government, and that is our priority, is making sure that that testing happens. So there's not an effect directly to LA financially because we did get an already deployed augmentation of federal funding. There is a contact tracing program for LA County. So the county public health runs this. This is a question from NCG. And right now it's all human contact tracers, which means that when you report that you have COVID or you're confirmed through one of our public health services that you have COVID, someone calls you to interview you about who you've seen recently. And then they track down and talk to them and let them know they have been exposed to COVID. And then sometimes there's a secondary track because those people then get tested. I don't know the original number of contact tracers that are normally on staff with the county, but it's something small like 30. And we are up to 1,500 contact tracers. So this is a very big and active program. A lot of those contact tracers are people who work elsewhere in the government. So maybe they're working for a library that's currently closed, or our park that's currently closed, or managing a concession at the zoo. So they're not necessarily health experts, but there's a state training program in California to train people on how to do contact tracing. And they're already, every employee in LA County and LA City is a sworn disaster worker. So when you start your job as a management analyst or a computer programmer, you also are sworn in as a disaster worker, which means that in the event of a disaster, you're on the hook for being able to support whatever's needed. So the contact tracing program is quite active. Kind of in line with that, I mean, that was actually a time, well, so one of the things is that in order to access a lot of these services, people need to get online. So the 301 call center has been extraordinarily busy, and we've stood up some other support services and other supplemental call centers for spillover on specific kinds of questions. So people can get answers to anything that they need, or schedule tests, or apply for these programs just over the phone. But we know that it's actually more efficient in many ways for people to be able to do it online. So we stood up a new site called Get Connected Los Angeles that has put together all of the different options for low cost or no cost internet. And many of the telecommunication companies have really stepped up during this time to provide different opportunities for folks. And so you can actually go to the site, put your address in, find all the different options for you. And for students and for educators, they are providing, and for healthcare workers, they're providing often free internet access for a period of time. It's been particularly helpful for our students in LA Unified School District. And then the next slide kind of speaks a little bit to that contact tracing question. So one of the things that was becoming clear as we started to look at reopening the city was that the number one question people had is it safe to go outside? And as a result, we realized we didn't know the answer about whether it was safer to go to this location or that location. So we opened up a challenge, kind of a geeky computational challenge, that was asking our global community of data scientists whether or not they were able to figure out a way to tell people how risky it was to go to specific locations in the city at specific times of day. So we opened up mobility data, transit data, number of visitors to different points of interest around the city that we had from historical data, information about the disease outbreaks and clusters in different neighborhoods. All of it was public information, but and public data. But we asked them to put together their ideas, and we gave people, instead of a normal sort of hackathon where people have 48 hours, we wanted them to be thoughtful. So over 2 weeks, people worked on these projects, and we had winners announced just a week ago. The winning team was from USC, from the Autonomous Networks Research Group. It was an amazing group of students and professors together who came up with a really great model on the risk of going to any place in the city, and the idea of how to mitigate that risk. And so that's now available in open source, and UCLA Computational Medicine is integrating that into their Stop COVID project, which is a symptom tracker across the city that people participate in. So these things together are going to give us a huge amount of information about how to better target services in specific neighborhoods and help both businesses and residents to be able to be safer. And then all of this is really part of an ongoing suite of things that we do at the city, and that we are always making sure that people are looking at. On the next slide, I just kind of point out a few of the different kinds of technologies that we offer and that we normally work with, everything from artificial intelligence to blockchain. We do gamification for, which I'll talk about in a second, for helping kids explore public spaces, not right now, but in general, normally. We're doing a lot with Internet of Things and predictive analytics. Some of this has really been playing a lot into our ability to understand what's going on with COVID, but we're also doing other things, and these services are generally still available. I do see a question here from Annalism about access to the outcomes of the hackathon. So that's available. I will post it in the chat and make these slides available. It's linked also from the slides. So I'll drop that into the chat as well. The next slide talks a little bit about some of the things that we normally do, which is trying to work with lots of folks across the city, whether it's businesses, citizens, universities, other cities around the world, our own staff, to be able to try to use data and technology in creative ways. The next slide points out a project that I helped to found at the city when I came on 4 years ago, which is the Data Science Federation. So in addition to the work I do at the city, I also teach at UCLA and have for a long time. And when I started, I realized that there was this challenge for how we, how teachers can make things available for their students and make people feel like they're really able to do something and have an impact in what they're doing. Normally, it's just sort of this class assignment. And what we realized is, what if we could combine three different needs? One is professors wanting their students to have a real impact, students wanting to do something effective and that mattered with their homework. And three is that we really needed more data science insights at the city and at lots of other cities. So we now have 18 local universities and colleges as part of this. Each year we gather projects from city departments, and we've now opened it up to many other cities. And those city departments come forward with challenges that they want to have worked kind of over a semester. Students and professors pick those challenges. We do a little bit of matchmaking. And they work on it in the course of a regular class, or sometimes students who have particular passion might come and work at the city as an intern for a while. And then those projects actually help to affect, how the government is run. So it makes a big difference, and it's a great program kind of for everybody involved. I'm just going to drop into the chat a couple of links that were just asked. So here's the COVID challenge that we put out. And then this one is for the link to the USC winning teams solution, which is available on GitHub. The next slide talks a little bit about why we also are interested in working so closely with universities. Often people in public policy or government will read a paper and then act upon it. So we see an interesting research paper that might better inform a policy, but what happens is that we don't necessarily talk to the researchers or understand, like we implement a change in a policy and then the researchers don't get feedback. So we actually create a bit of a virtuous circle here, where research leads to data that helps to inform an action. And then because we have this ongoing relationship with our Data Science Federation and university partners, we're able to really work with them in a way that helps to inform their ongoing research. And so this helps us in lots of ways to just continually optimize our policies and kind of be open to how the public is using them and the impact on that. I'm just going to cover a couple more slides and then I'm going to get to the rest of the questions. So the next slide shows one of the ways that we engage people a lot, which is our MyLA 311 app. This is a way, so you can call 311, but you can also go online, either on the mobile app or the web platform and be able to make a request of anything that you need. So whether it's wanting to get a tree planted in front of your property, or have a dead animal picked up, or if there's somebody dumps some trash, or there's graffiti, or you just have a question, you can go ahead and enter that into the app and be able to geocode it, just kind of quick take a picture of what's going on and be able to send that in. And then generally within 48 hours, we're able to fix many of those problems. So in 48 hours, we'll fill a pothole or remove graffiti. And it's just a great way of kind of making people have the power to initiate those services immediately. The next slide points out some of the ways in which we try to also communicate this, because not everybody, again, is fully online or is sort of as digitally literate. We find that our senior population, for example, is really using a lot of sort of personal assistants like Alexa to be able to use voice-driven technology. And so you can actually ask a question of Alexa, and we have a whole bunch of city services built in. So if you want to say, where can I get a meal at a senior center in Los Angeles, it'll tell you, or what's happening this weekend in Los Angeles, and it'll give you a calendar of events. So again, another way of being able to reach to our different populations that want to interface in a different way, but also across multiple languages. And the next one kind of reaches to the other side of the demographics. This is a really fun application that we have that's mobile called Agents of Discovery. And this is an augmented reality app that kids use in our parks when everything's up and open. And they can go and explore and sort of capture through AR, like a Pokemon Go kind of thing, different kinds of creatures that live in and around Los Angeles, and find out more about those. There's 40 different missions in our parks across the city that you can go and explore. And you can actually, if you're a scout, you can actually win merit badges, physical merit badges, to be able to show that you're part of our exploration team. And then the next piece is really kind of the fact that we have this amazing lab. In 37 of our libraries, we have maker spaces, like 3D printers and different kind of robot classes. And so we have this really a beautiful space called the Octavia Lab, named after Octavia Spencer, who's an African-American science fiction writer here in Los Angeles, and who did her early research and writing at our central library. So the Octavia Lab is this great exploration place. We have a podcast studio for people to be able to try out and do podcasts. We have fashion design, we have CAD drawing machines, 3D printers, all kinds of fun things for people to explore different kinds of science and technology options. The next slide talks about another project that we're involved in. This is a NASA project, actually, a grant from NASA that I'm the principal investigator on, called Predicting What We Breathe. And this is related to air quality and how we look at the impact of air quality throughout Los Angeles, and what we're doing around air quality that is helping from a city perspective. So we use machine learning against large data sets of data we're collecting from ground sensors with the South Coast Air Quality Management District and at our libraries and on a variety of city services and streetlights. We combine that with NASA and European Space Agency satellite data in order to be able to kind of get a holistic view of what's going on. And we use machine learning to create predictive models so that we can understand historically what's happened when we plant trees in a neighborhood, and over time those trees mature. Does it affect the air quality? And generally, yes. We can also look at when we've changed city policies related to pollution levels, or when we move from the winter to the summer blend in gasoline in our vehicles. So we want to understand what are the most effective ways for us to be able to improve air quality. Our partners on this include things like people like Anthem Blue Cross, the Southern California Asthma Association, and our research partner on this project is Cal State LA. So I'm just going to ask Subhash if you just kind of click through the next few slides. We work with the LA Cyber Lab, which helps local businesses to be able to do cybersafe and understand cyber safety and cybersecurity in a very simple way. So this is really geared for mom and pop businesses that may not have a lot of IT security needs or staff, but we want to help them be as safe as possible as they transact business online. The next slide shows our open data portal, where a lot of this information is available across a variety of different areas, from energy and the climate to housing and transportation. The next slide talks a little bit about, shows you an example of autonomous vehicles, which is really sort of where we were focused a lot a year ago and where we will be focused again. But the idea of, kind of moving to autonomy in the public rights of way, how does that affect what we're doing, and how does that affect how we make sure that people are safe on the streets? And speaking of safety, if you click ahead 2 slides, you will see our Shake Alert LA app. So Shake Alert LA is an earthquake early warning app that provides people with information, with a notification in advance of the shaking that you're about to feel shaking and how intense that shaking is going to be. And so this is for shaking that could be potentially damaging. So it's not just a small shake, but a bigger shake. Those thresholds are set by the U.S. Geological Survey, who's our partner on this. And this provides that warning capability. It was the first of its kind to be able to do this, and since then we've been able to help others build these capabilities. And then the last thing I just want to mention is the fact that LA is part of the UN's Sustainable Development Goals. We normally see countries adhering to these goals of trying to decrease poverty and hunger and improve equity across their nation. In the case of Los Angeles and a handful of other cities, we felt that we're also committed to these. And so if you go to this site, you'll find that behind each of these little icons for each of the goals is the next slide. We've actually put the data that we're measuring ourselves against and whether we're meeting the indicators. So in this case, we're looking at gender equality. And so the idea is whether or not we're making information available. And behind all of this is also the data. So you too can go in and look at what we're doing. The last slide is really just one in a time where we're dealing with so much tragedy and so much loss, there are still things in the future to look forward to. And so LA will be hosting the Olympics for the 3rd time in 2028. And there's a lot of infrastructure and work that we're doing with data and our communities around that. I see 2 other questions have come in. So I'll just touch base with those and then kind of open it up.
Hey, Jean, before you get started, maybe we should just launch the poll, and then while you're answering these questions, people can answer the poll as well.
Yeah, I'm not sure from my screen I can launch the poll.
I just launched it.
Oh, there you go. So yeah, I was just going to kind of see, as all these things are happening, it's always interesting from a city's perspective to understand what the priority is from your perspective. So we're trying to improve public health, which often means telling people to stay away from each other and keep businesses closed. But at the same time, we're trying to help people who are in economic need and need businesses to reopen in order to have their jobs back. So I just wanted to say, from your perspective, what is the most essential city service during this time from what you feel right now? And so if you could just take this poll, it would be great to get a pulse from what people are thinking about. So Sarala asks, is the current contact tracing program good enough? Wouldn't it be more accurate, faster, and cost-effective to embrace an app-based contact tracing solution? So this is an ongoing conversation, and different cities are approaching it in different ways. LA County is really focused on making sure that they are able to handle contact tracing in the traditional way, where they can call somebody up and work with, kind of talk them through the process of needing to go in and get tested, and be able to make sure that folks understand the importance to go and get tested and then make sure they quarantine. So they feel that it's important to motivate people to adhere to those guidelines. Some cities and states are doing a combination, which I think is also very powerful. So they do an app as well as asking people to do the human contact tracing. The app augments sort of human memory. If I'm on a bus and going into work, and then the next day I find out that I was contagious and had COVID after I've gotten tested, then I don't know who it was who stood next to me on the bus, nor do I know who sat in that seat after me on the bus and might have gotten infected. So the combination can be very powerful. The the ability to do that contact tracing is available through a technology offered by Google and Apple together, which uses anonymized Bluetooth technology. So that if you agree to do this and you install an app that is using that technology, then you can opt in for that. And some states and cities have done that. But when we looked at what was going on, Singapore, the country of Singapore, was the first one to do that with a slightly different technology base. And only, even after a lot of coercion and a lot of trust for Singaporeans in their government, only about 12% of the population participated. So, Sorel, there's not like an easy answer to that. It is interesting to try the combination though and see if the combination is powerful. And then Michelle asked, where are you seeing the greatest need for data science analytics to help solve city challenges? And are you able to share a few of the use cases from those need areas? Yeah, so we are seeing a huge need for data science and analytics. And as Subhash said at the beginning, we're actually asking people to participate in some volunteer options with Data for Good that can help to kind of address some of these issues. We also have the Data Science Federation for people who are in school, and we also have a Data Angels program at the City of Los Angeles that allows people to kind of target an area they would like to volunteer in. We're realizing that in addition to the regular stuff we're normally struggling with, traffic and air pollution, that right now we're really looking at a variety of things. One is we listen a lot to what people are saying that they need. That listening requires us to do essentially sentiment analysis on social media, and we have a lot of tools to do that. But even things like that, understanding the messaging and what languages need to be communicated across, like simple data science problems like that, to complex ones like our COVID Computational challenge, where we realized nobody really knew how to create this risk score for a location, and so we opened it up globally. And so we're seeing the need in those areas, as well as really this idea of how do we predict the next wave of COVID and when it's going to happen, and then particularly in LA, where we're not really seeing an end to the first wave yet. And then how are we able to keep people as safe as possible? And then Errol asked, what can the city do to encourage commuters back to urban transit? Yeah, that's a great question, Errol. Is there enough parking if everyone drives? So I think public transit is a difficult challenge when you're concerned about infection. We are doing a lot to keep everything as clean as possible and antiseptically clear and clean. Metro's doing this on the light rail, and we're doing it on our city buses. But we still know that you're in a constrained place with other people, and this will, if you have the option to drive, a lot of people will probably choose that option if they're concerned about contamination. Some people, unfortunately, don't have that option because of economics. So we are encouraging people to take public transit and understand how safe it is. Right now, we aren't quite back to the traffic levels that we've had before. There's quite a few businesses that are either still closed or open in a limited way. And places like the city of Los Angeles, we're still having our employees telework to keep people off the roads and keep potential contamination down. So I don't know if there would be enough parking if every single person drove everywhere. Certainly we want to get back to the point post-vaccine that people are taking public transit safely and securely. So I don't know if there are other questions.
So the poll, we have about 87% people voted. Majority of the poll was voting for improving public health with 63%. I'm going to end the poll now, so maybe Jean, you can take a look at it at some point.
Mm-hmm.
Okay, so everyone should be able to see the results.
Right. So that's a pretty clear indicator that I think people are very focused on making sure everybody's healthy. And I'm feeling really grateful to all of you for the fact that you're concerned about making sure you're healthy, but then also making sure that others are healthy. I think we're seeing all sorts of strange uh, ideas around, the ability to kind of help people stay healthy during this time. And then definitely, we also feel that need around helping people in economic need, which is the second most popular answer here. We want to make sure that these programs like the Angelino card and the senior meals program and helping businesses get the support and services they need to restart and reopen and rehire, that all of those are being supported. And then um, sort of the third priority seems to be, or the third most popular was helping businesses reopen. And but that's also important because we do need to get people back to work, and we do need to make sure people are getting an income, and we want to make sure that businesses can survive. This has been super hard on a lot of businesses, and not everyone is going to be able to reopen after this long delay. And so we really want to make sure that we're focused as a city on all three of these things at the same time.
If anyone else has a question, no, please use the Q&A link. You may wait for a few seconds. Okay, we just got one more, Gene, that came in.
Great. So this one's from Wesley. How do you see your office's role in supporting policy decisions around social issues among vulnerable communities like criminal justice inequities or homelessness? It's a great question, Wesley. So the chief data officer's role is absolutely to try to provide transparent data analysis that is clear and ethical and as unbiased as possible. It's very hard to have no bias in any analysis. Part of what we've been working on around, so I'll just talk about these two specific things you talk about. One around homelessness. One of the things is we're trying to understand the impact of who's at risk of falling into homelessness. And this is work we've been doing with the UCLA California Policy Lab for several years now, with the city and the county. So we're trying to understand who, when somebody comes in for services at the city or county, like what are the risk factors they might have that we might need to give them some additional support. There are many services that people can ask for, but they may not know that they can get rental assistance, for example, if they're in danger of getting evicted, or legal support to avoid evictions if they just need to understand how to navigate the system. So we're doing things like that, and then also right now looking at what happens. There's an eviction moratorium for businesses and individuals, so nobody can be evicted from their apartment, their house, or their business right now. But eventually that will lift, and when it does, we know that there's likely going to be a lot of people who aren't going to be able to catch up on their rent. Although in the city, we've told landlords we've asked them to give people a year to catch up on that rent. Um, Nonetheless, the landlords themselves also have bills to pay and mortgages. So it's a challenge. We're looking at where the evictions are most likely to happen, where people are sort of most at or below the poverty line, and trying to figure out how we can support that. The city council just voted 2 days ago to pull $100 million out of this additional federal funding to support people who are at risk of eviction as rent support. So that's one of the ways we're doing it. And then the criminal justice inequities, I think, is really important to just confront straight on. So we have worked with LAPD to open up a lot of data over the last few years around use of force, people who die in custody, and the racial profiles of folks who get pulled over by the police. So that information is available on our open data portal. The mayor, before all of this, back in December, had decided to create a new civil rights commission, and with our amazing deputy city attorney, Capri Maddox, who is an absolute advocate and a force of nature around these issues. He's expanded that to a whole new department that will take some funding from the LAPD and reinvest it into communities and around these ideas of criminal justice inequities. so she's leading that effort. And then Brenda Shockley, who's our current deputy mayor for economic opportunity. So she normally focuses on a lot of these issues around poverty and equity. She's just been also named our chief equity officer. And so our team is working with her to be able to say, what are the indicators that we would have around justice, racial equity, social equity? How do we become transparent? How do we measure ourselves? How do we help have those, sometimes difficult conversations with our citizens and residents and folks to be able to talk about what is not safe and fair in the city and how we can fix that. So we're very actively involved in that, and some amazing people who really have fought their entire lives to help champion these issues are leading that charge.
Thanks, Jean. If anyone else has any questions? Just to give you a heads up, I just posted this on the chat. Since today we heard from the city of LA, Jean, we're going to do another one from the county of LA. The deputy CIO will be presenting on July 23rd. So we'll be sending you an invite for that pretty soon. We'd love to have you join there as well. Any other questions for Jean? Or Jean, you want to talk about anything else?
I just want to thank everybody for all of the work that they've been doing. It has not been an easy time anywhere in the world, and it's not been an easy time in Los Angeles. And whether you live here or you're tuning in from somewhere else, I just want to thank you for the work that you are each doing, the sacrifices that have been that you've either met or have been forced upon you as you work through this time of keeping people safe, caring for loved ones, dealing with unemployment or businesses that are challenged, and working together to make our community stronger. So I just want to thank all of you for what you've been doing.
Thank you, Jean, and I agree. I endorse what Jean was saying. So thanks everyone again for being safe and staying safe, and following all the rules and regulations that come out of the city and the county. Without your help, we can't take this to the next step, which is where we need to be at some point. Thank you, Jean.
Great. Thank you so much, Subhash, for everything you're doing.
Thank you. Thank you, everyone, and hope to see you again in the next event. Thanks.